If you and your doctor have decided that joint replacement surgery is the best option for you, you will be actively engaged in the planning and recovery process, and we are here to help. You will receive quite a bit of information from your surgeon on what you need to be scheduling and planning for your orthopedic surgery, including identifying a caregiver that can help for a minimum of 48 hours after returning home. Our Stepping Forward class is where we dive a bit deeper into what to expect before, during, and after surgery. The class is led by a nurse and a therapist and attended by our upcoming patients, and we encourage caregivers to attend. The Stepping Forward class also provides a platform for asking questions of the nurse and the therapist. Often, participants are appreciative of the questions brought up by others in the class. There is also an online version if you or your caregiver are unable to attend. While at the hospital, post-operatively, most patients will be up and walking within a few hours after surgery. The staff will be checking on you frequently, doing things like checking your blood pressure, making sure you're eating and drinking, and helping to control pain so that you can be walking and participating in your therapy. The staff has a lot of education and information to share. Some of it may be reiterated from your notebook or information that you've received from your orthopedic team, or things that you've heard in the Stepping Forward class, while some details may even be new instructions for discharge. As you might imagine, the time surrounding surgery might feel overwhelming. It is important to have your caregiver present for your therapy sessions and discharge teaching as an extra set of eyes and ears to take in all the information so that you can get the most out of your recovery. Typically, our hip and knee replacement patients are considered outpatients and are often able to go home later that same day or within 24 hours of surgery. You will then continue the recovery process in the comfort of your own home. Keeping in mind, recovering from a knee or hip replacement can take weeks to months. We at Pro Healthcare look forward to helping you through every step of the experience.
Once you and your orthopedic surgeon decide that it's time to have your joint replacement surgery, your orthopedic surgeon will ask you to see your primary care provider within 30 days of having that surgery. The goal of the preoperative evaluation is to try to identify medical risks that can impact surgical outcome and to lessen those risks before proceeding with your orthopedic surgery. It can be helpful to have the evaluation done earlier in the process in case certain medical conditions are identified that do need further evaluation before surgery. Your provider will be asking you about your cardiac history or heart history. Certain cardiac issues can impact the timing of the joint replacement surgery. If you have diabetes, it will be important that your diabetes is controlled well enough to proceed with the surgery. Poorly controlled diabetes can slow wound healing and can increase risk of infection. So it's very important that the diabetes be adequately controlled before going into surgery. Significant sleep apnea can result in respiratory complications following surgery, so it's important that that be identified before the surgery. If you have sleep apnea that is treated with either CPAP or BiPAP, it will be very important for you to make sure that you're wearing your PAP therapy before and after surgery. Even whether or not you smoke can impact surgical outcome. So if you do smoke, it will be important to either quit prior to the surgery or at least cut back as much as possible before going into surgery. Your provider will be counseling you on which medications should be stopped before the surgery and the timing that they should be stopped, and which medications should be continued. Sometimes it's just as important for certain medications to be continued through surgery as which medications should be stopped. Surgery is very safe these days, but we do want to ensure that we understand your medical conditions as well as ask about other medical conditions that can impact surgical outcome. Your orthopedic surgeon and your entire team all want the same outcome, and that's for you to be able to enjoy your new joint for years to come.
Physical therapy plays a pivotal role in joint replacement surgery outcomes. Once you decide on having a joint replacement surgery, you will receive a booklet with the designated exercises that you are to perform. These exercises target the muscle groups that are affected by joint replacement surgery. We recommend you perform them twice a day prior to surgery, in addition to performing them twice a day when you return home. By performing your exercises twice a day, you're helping to improve your outcomes. If you are having a total hip replacement, outpatient physical therapy is not typically needed after surgery. Your physical therapist will work closely with you to ensure you have proper understanding of your home exercise program, as this is essential in your recovery. If you need additional therapy, your physical therapist will determine that in the hospital, and your care team will help set that up prior to your return home. For our total knee replacements, the standard of care is to follow up with outpatient therapy after you leave the hospital and return home. It is recommended that your caregiver is present for your physical therapy session while you're in the hospital. This is because physical therapy will be providing significant education on proper movement techniques, and it's important that your caregiver sees the proper movement techniques so they can better assist you to ensure a safe return home. After joint replacement surgery, your physical therapist will assess your need for an assistive device. It is recommended that you have a walker in place or have a plan for one prior to your return home, as you will need it after you have your joint replaced. In the hospital, you also can have a walker billed to you through insurance, in which your physical therapist will fit it for you prior to return home. Prior to having joint replacement surgery, it's important you make note of your home entry. You will inform your physical therapist of what stair needs you have to enter your home once you get to the hospital. While you are in the hospital, your physical therapist will train you how to perform the stairs safely to ensure a safe entry into your home. It is recommended, if you can stay on the main floor after joint replacement surgery, that you do so. So having your needs brought to the main floor prior to surgery is essential in setting you up for success. It's important you remove any throw rugs or tripping hazards so that you can use your walker safely once you get home. Additionally, in any of the central living areas or in the bedroom, it's important you move furniture to allow for the walker to fit. It's also important that you avoid sitting to any low surfaces, as these are more difficult to get out of after joint replacement surgery. Ideally, having a good chair set up on the main living level is important prior to you have surgery, so it's in place when you get home. It is a joy to work with joint replacement surgery patients while in the hospital. Our role is to set you up for success and get you moving again.
At Pro Healthcare, when you schedule your joint replacement surgery, you're guaranteeing that you're going to have an anesthesiologist with you the entire way. We want to ensure that you're relatively pain-free after your surgery, and we'll choose the best anesthetic for you. Your anesthesiologist will review your medical history and consider your surgical procedure to come up with the best plan for you. Almost all total knee replacements and most total hip replacements are performed under spinal anesthesia. Spinal anesthesia is performed in the operating room. Your anesthesiologist will inject a small amount of medication in your lower back to help numb you up for surgery. There's a lot of benefits to spinal anesthesia, one of which is better pain control after your surgery. It's a common misconception that even though you receive a spinal anesthetic, you are still awake during your procedure. But for your total joint replacement surgery, we still give you medications to help keep you comfortable and asleep for your surgery. No matter what, your anesthesiologist will make sure that you're comfortable and safe in the operating room. For your total knee replacement surgery here at Pro Health, your anesthesiologist will place a small nerve block catheter in your upper thigh that continuously infuses local anesthetic to help numb up the front part of your knee. Patients are sent home with this infusion, and it's designed to be in place for up to 72 hours after surgery. You will be provided with instructions on how to care for this catheter at home. We also provide a single-shot injection to the nerves in the back of the knee to ensure that you are more pain-free after surgery. After your total knee replacement, an anesthesiologist will follow up with you in the hospital or will call you at home if you're discharged. All of the anesthesiologists here at Pro Health are here for you, making sure that you're safe, comfortable, and get back on your feet sooner.